If you have an enlarged prostate or want to protect your prostate health, there's something you might not know. Some common foods are making your condition worse. In this video, we'll reveal the harmful foods you should avoid, and trust me, the food at number 4 is particularly damaging to your prostate. It's something many people eat every day without realizing the harm it's causing. Stay tuned to learn what these foods are and how you can start protecting your prostate right now. You won't want to miss this. First, we have alcohol. Alcohol consumption has been linked to various health issues, including its impact on prostate health. While moderate drinking might not pose significant risks for some individuals, excessive or chronic alcohol intake can harm the prostate and exacerbate existing conditions. One of the primary concerns is alcohol's ability to promote inflammation, a key factor in the development and progression of prostate problems. Alcohol can irritate the urinary tract, including the bladder and prostate, leading to frequent urination and discomfort. This irritation can be particularly problematic for individuals with an enlarged prostate or benign prostatic hyperplasia, BPH, as it exacerbates symptoms like urgency and weak urine flow. The diuretic properties of alcohol further contribute to this issue by increasing urine production, placing additional strain on the prostate and urinary system. Alcohol also affects hormonal balance, which is critical for maintaining prostate health. Chronic alcohol consumption can lower testosterone levels and increase estrogen levels in men. This hormonal imbalance can contribute to prostate enlargement and may even play a role in the development of prostate cancer. Additionally, alcohol's effect on liver function can impair the body's ability to regulate hormones, further compounding the problem. Oxidative stress is another factor to consider. Alcohol consumption increases the production of free radicals in the body while depleting antioxidants. This imbalance leads to oxidative stress, which can damage cells and tissues in the prostate. Over time, this damage can promote chronic inflammation and increase the risk of prostate-related diseases. Alcoholic beverages, particularly beer and spirits, often contain compounds like phytoestrogens, which mimic estrogen's effects in the body. These compounds can disrupt normal prostate function and potentially encourage abnormal cell growth. While more research is needed in this area, the presence of such substances raises concerns about their long-term impact on prostate health. Men who consume alcohol are also more likely to engage in unhealthy lifestyle habits, such as poor diet and lack of exercise, which further contribute to prostate problems. A diet high in processed foods and low in nutrients, combined with alcohol's impact, can weaken the immune system and make it harder for the body to fight inflammation and disease. Alcohol's impact on hydration is another important consideration. Chronic dehydration caused by excessive alcohol intake can thicken the blood, reducing the flow of oxygen and nutrients to the prostate. Proper hydration is essential for maintaining prostate health, and alcohol's dehydrating effects can significantly hinder this process. Studies have shown a link between alcohol and an increased risk of advanced prostate cancer. While the exact mechanisms are not fully understood, researchers suspect that alcohol's ability to impair immune function and promote chronic inflammation plays a significant role. Men with a history of heavy drinking may be at greater risk of developing aggressive forms of prostate cancer. For individuals already dealing with prostate issues, alcohol can interfere with treatment and worsen symptoms. For example, medications used to manage BPH or prostatitis may be less effective when combined with alcohol, as it can alter the way these drugs are metabolized by the body. Additionally, alcohol can weaken the immune system, making it harder for the body to recover from infections or inflammation. Next, we have bananas. Bananas are often celebrated as a healthy and nutritious fruit, but there are misconceptions about their impact on prostate health. While bananas provide essential vitamins and minerals, they may contribute to prostate issues under certain conditions. Understanding the potential risks is essential for those concerned about maintaining optimal prostate health. One concern is the sugar content in bananas. Although the sugars in bananas are natural, excessive consumption can lead to spikes in blood sugar levels. High blood sugar can contribute to inflammation in the body, including the prostate. Chronic inflammation is a known factor in the progression of prostate-related conditions, such as benign prostatic hyperplasia, BPH, and prostatitis. Bananas also contain a type of carbohydrate called fructose. High intake of fructose, especially in conjunction with other sources of sugar in the diet, can lead to insulin resistance over time. Insulin resistance has been linked to hormonal imbalances, which may negatively impact prostate health. Hormonal shifts can promote prostate enlargement and increase the risk of developing prostate cancer. Another factor to consider is the potassium content in bananas. While potassium is essential for muscle function and fluid balance, excessive potassium levels can sometimes lead to issues with cellular function. For individuals with compromised kidney function, high potassium intake may put additional strain on the kidneys and indirectly affect the prostate by altering fluid and electrolyte balance. Bananas are also a source of natural plant compounds like serotonin precursors and certain alkaloids. These compounds, while beneficial in moderation, may interfere with some medications used for prostate health. For instance, they can potentially alter the effectiveness of drugs prescribed for reducing prostate inflammation or managing symptoms of an enlarged prostate. For individuals prone to digestive issues, the high fiber content in bananas can sometimes lead to bloating and gas. This can put pressure on the lower abdomen, including the prostate region, and exacerbate discomfort in men already dealing with prostate conditions. Maintaining a balanced fiber intake is important to avoid these side effects. The ripeness of bananas can also influence their impact on the body. Overripe bananas have higher sugar content, which can further contribute to inflammation and metabolic imbalances. Consuming large amounts of overripe bananas may, therefore, have a more pronounced negative effect on prostate health compared to underripe or moderately ripe bananas. Bananas may also indirectly affect prostate health through their role in dietary patterns. Individuals consuming excessive bananas might neglect other nutrient-rich foods essential for prostate health, such as vegetables, nuts, and seeds. A lack of dietary variety can lead to nutritional imbalances that may worsen prostate conditions. Men who are allergic or sensitive to bananas should also exercise caution. Even mild allergic reactions can cause systemic inflammation, which can indirectly impact the prostate. Identifying and avoiding food sensitivities is an important step in managing inflammation and supporting overall health. Next, we have caffeinated soft drinks. Caffeinated soft drinks are a popular choice for many, but their impact on prostate health is often overlooked. These beverages contain a combination of ingredients that can harm the prostate and worsen existing conditions. Understanding how these drinks affect the body is crucial for maintaining prostate health and preventing further complications. One of the primary concerns is the high caffeine content in these drinks. Caffeine is a stimulant that can irritate the bladder and the prostate, leading to increased urinary frequency and urgency. For individuals with benign prostatic hyperplasia, BPH, or prostatitis, these symptoms can become more severe, significantly impacting quality of life. Caffeinated soft drinks are also high in sugar or artificial sweeteners. Excessive sugar consumption contributes to chronic inflammation, a key factor in the development and progression of prostate problems. Chronic inflammation can worsen conditions like BPH and may increase the risk of prostate cancer. Artificial sweeteners, while calorie-free, can disrupt gut health and potentially contribute to systemic inflammation, further harming the prostate. The acidity of caffeinated soft drinks is another issue. These beverages often have a low pH due to additives like phosphoric acid, which can irritate the urinary tract and prostate. Over time, this irritation can lead to chronic inflammation and worsen symptoms in men with pre-existing prostate conditions. Soft drinks often contain high levels of sodium, especially in certain varieties. Excessive sodium intake can lead to fluid retention and increased blood pressure, indirectly affecting prostate health. Poor circulation and fluid imbalances can make it harder for the body to manage inflammation and repair damaged tissues in the prostate. Another concern is the presence of harmful chemicals like preservatives, artificial colors, and flavorings in soft drinks. These additives can introduce toxins into the body, increasing oxidative stress. Oxidative stress damages cells and tissues, including those in the prostate, and can accelerate the progression of prostate-related conditions. Caffeinated soft drinks can also contribute to dehydration. Caffeine acts as a diuretic, causing the body to lose fluids more rapidly. Dehydration thickens the blood and reduces nutrient and oxygen delivery to the prostate, impairing its function and healing ability. Adequate hydration is essential for maintaining prostate health, and these beverages often do the opposite. Men who consume caffeinated soft drinks regularly may also experience hormonal imbalances. Excessive sugar intake, combined with other ingredients, can affect insulin levels and lead to metabolic syndrome. Hormonal disruptions are linked to prostate enlargement and an increased risk of prostate cancer, making it vital to avoid dietary habits that exacerbate these issues. The carbonated nature of soft drinks can lead to bloating and increased abdominal pressure. This pressure can affect the lower urinary tract and prostate, worsening symptoms like weak urine flow or difficulty emptying the bladder. For men with prostate issues, these effects can be particularly problematic. Long-term consumption of caffeinated soft drinks may also interfere with the effectiveness of medications used to treat prostate conditions. Some ingredients in these beverages can alter drug metabolism or increase side effects, making it harder for men to manage their symptoms effectively. Avoiding these drinks can help improve treatment outcomes and overall prostate health. Next, we have processed foods. Processed foods are a staple in many diets, but they can have significant negative effects on prostate health. These foods are often loaded with harmful ingredients that can contribute to inflammation, hormonal imbalances, and other factors that worsen prostate conditions. Understanding the risks associated with processed foods is essential for protecting prostate health. One of the biggest concerns with processed foods is their high content of unhealthy fats, particularly trans fats and saturated fats. These fats promote inflammation throughout the body, including the prostate. Chronic inflammation is a major factor in the development of benign prostatic hyperplasia, BPH, and can increase the risk of prostate cancer over time. Processed foods are also typically high in refined carbohydrates and added sugars. These ingredients cause spikes in blood sugar and insulin levels, which can lead to metabolic syndrome and hormonal imbalances. Such imbalances, particularly in testosterone and estrogen levels, can exacerbate prostate enlargement and contribute to the progression of prostate diseases. Another issue with processed foods is their high sodium content. Excessive sodium can lead to fluid retention and elevated blood pressure, which can impair blood flow to the prostate. Poor circulation hinders the delivery of oxygen and nutrients necessary for maintaining healthy prostate function and repairing damaged tissues. Many processed foods contain artificial additives, preservatives, and flavorings that can introduce toxins into the body. These substances can contribute to oxidative stress, which damages cells and tissues in the prostate. Over time, this cellular damage can lead to chronic inflammation and increase the risk of developing prostate-related conditions. Processed meats, such as sausages, hot dogs, and bacon, are particularly problematic. They often contain nitrates and nitrites, which are used as preservatives. When metabolized, these compounds can form carcinogenic substances that increase the risk of prostate cancer. Regular consumption of processed meats has been linked to a higher likelihood of developing aggressive prostate cancer. The lack of essential nutrients in processed foods is another major concern. These foods are often stripped of vitamins, minerals, and fiber during processing. A diet lacking in these nutrients can weaken the immune system, making it harder for the body to fight off inflammation and protect the prostate from disease. Processed foods also disrupt gut health by altering the balance of beneficial bacteria in the digestive system. A healthy gut is essential for managing inflammation and supporting overall health. The additives and low fiber content in processed foods can harm gut microbiota, indirectly impacting prostate health. Over-reliance on processed foods can lead to unhealthy weight gain and obesity. Obesity is a known risk factor for prostate problems, as it contributes to systemic inflammation and hormonal changes that negatively affect the prostate. Reducing processed food intake is a critical step in maintaining a healthy weight and protecting prostate function. Long-term consumption of processed foods may also interfere with the effectiveness of treatments for prostate conditions. Poor dietary habits can reduce the body's ability to respond to medications and other therapies, making it more difficult to manage symptoms or recover from prostate-related issues. Shifting to a diet rich in whole, unprocessed foods can improve treatment outcomes and overall prostate health. Next, we have dairy products. Dairy products are a common part of many diets, but they may have harmful effects on prostate health. While they provide nutrients like calcium and protein, certain properties of dairy products can contribute to the development or worsening of prostate issues. Understanding these risks is essential for those seeking to maintain a healthy prostate. One of the primary concerns with dairy products is their high saturated fat content. Saturated fats can promote systemic inflammation, which negatively affects the prostate. Chronic inflammation has been linked to benign prostatic hyperplasia, BPH, and may also increase the risk of prostate cancer. Regular consumption of high-fat dairy products can exacerbate these inflammatory processes. Dairy products can also contribute to hormonal imbalances that impact prostate health. Milk, for example, contains natural hormones like estrogen and insulin, like growth factor 1, IGF-1. Excess IGF-1 levels have been associated with an increased risk of prostate cancer, as they can stimulate the growth of abnormal cells in the prostate gland. Another issue is the potential link between high calcium intake from dairy and prostate cancer. Excessive calcium consumption may suppress the production of vitamin D, a hormone that plays a critical role in regulating cell growth and maintaining prostate health. Low vitamin D levels can lead to unchecked cell proliferation, increasing the risk of prostate cancer. Dairy products also contain casein, a type of protein that some studies suggest may promote cancer cell growth. Casein is metabolized differently in the body compared to plant-based proteins and may lead to inflammation or other negative effects on prostate tissue. Reducing dairy intake can help limit exposure to this protein. Processed dairy products, such as cheese and flavored yogurts, often contain added sugars and artificial ingredients. High sugar intake contributes to chronic inflammation and metabolic imbalances, both of which can worsen prostate conditions. Additionally, preservatives and additives in processed dairy products can introduce harmful chemicals into the body, increasing oxidative stress and damaging prostate cells. For individuals who are lactose intolerant, dairy consumption can trigger digestive issues like bloating and inflammation. These symptoms can indirectly impact the prostate by increasing pressure in the lower abdomen and exacerbating urinary discomfort, particularly in men with existing prostate conditions. Dairy products may also negatively influence gut health, which plays a crucial role in managing inflammation throughout the body. The disruption of gut microbiota caused by certain dairy components can lead to systemic inflammation, indirectly harming the prostate. Maintaining a balanced gut environment is key to supporting overall prostate health. Obesity, a known risk factor for prostate issues, is another concern associated with excessive dairy consumption. High-calorie dairy products, when consumed regularly, can contribute to unhealthy weight gain. Obesity increases systemic inflammation and alters hormone levels, both of which can aggravate prostate problems and raise the risk of prostate cancer. Next, we have red meat. Red meat, while a popular dietary staple, has been linked to negative effects on prostate health. Consuming red meat in large quantities or regularly can contribute to various prostate issues, including inflammation, hormonal imbalances, and even an increased risk of prostate cancer. Understanding the properties of red meat and how they affect the prostate is essential for making healthier dietary choices. One major concern is the saturated fat content in red meat. Saturated fats are known to promote inflammation in the body, including in the prostate gland. Chronic inflammation is a key factor in the development of benign prostatic hyperplasia, BPH, and can also contribute to the progression of prostate cancer. High-fat diets, especially those rich in red meat, can worsen existing prostate conditions and create an environment that supports disease. Cooking methods used for red meat can also play a significant role in its impact on prostate health. When red meat is grilled, fried, or cooked at high temperatures, it can produce carcinogenic compounds like heterocyclic amines, HCAs, and polycyclic aromatic hydrocarbons, PAHs. These compounds damage DNA and can trigger cancerous changes in prostate cells, increasing the risk of aggressive prostate cancer. Red meat is also rich in heme iron, a type of iron found in animal tissues. While iron is essential for the body, excessive heme iron can lead to oxidative stress, a condition where free radicals damage cells and tissues. Oxidative stress in the prostate can contribute to cellular damage and inflammation, exacerbating prostate issues and increasing the risk of cancer. Processed red meats, such as sausages, bacon, and deli meats, contain additional harmful substances like nitrates and nitrites, which are used as preservatives. These compounds can convert into nitrosamines in the body, which are known carcinogens. Regular consumption of processed red meat has been strongly associated with a higher risk of prostate cancer compared to unprocessed varieties. Red meat consumption can also affect hormone levels, particularly testosterone and estrogen. Imbalances in these hormones are linked to prostate enlargement and an increased risk of prostate cancer. Diets high in red meat may disrupt these hormonal levels, making it harder for the body to maintain a healthy prostate. Another concern is that diets heavy in red meat often lack essential nutrients, such as fiber and antioxidants, which are critical for maintaining prostate health. Fiber helps regulate hormone levels and supports gut health, while antioxidants combat oxidative stress. A diet lacking these nutrients can create an imbalance that leaves the prostate vulnerable to inflammation and disease. Excessive consumption of red meat has been associated with obesity, a condition that increases the risk of prostate problems. Obesity contributes to systemic inflammation, hormonal disruptions, and a higher likelihood of developing aggressive forms of prostate cancer. Reducing red meat intake can help manage weight and improve overall prostate health. High levels of animal protein from red meat can lead to higher acidity in the body. To neutralize this acidity, the body may pull calcium from bones, potentially affecting overall mineral balance. This imbalance can indirectly impact prostate health, as calcium plays a role in cellular function and may contribute to the progression of prostate issues when levels are disrupted. Last, we have spicy foods. Spicy foods are enjoyed by many for their bold flavors and heat, but they can have negative effects on prostate health, especially for those already dealing with prostate issues. The compounds that give spicy foods their intense flavor may irritate the urinary tract and prostate gland, leading to discomfort and worsening existing conditions. Capsaicin, the active compound in chili peppers, is responsible for the heat in spicy foods. While capsaicin has anti-inflammatory properties in small amounts, excessive consumption can irritate the lining of the bladder and urethra. This irritation can cause inflammation in the surrounding tissues, including the prostate, which may exacerbate symptoms of benign prostatic hyperplasia, BPH, or prostatitis. Spicy foods are also known to increase blood flow to the pelvic area. While this may not seem harmful, excessive blood flow in this region can lead to swelling and pressure on the prostate gland. For men with an enlarged prostate, this can result in increased urinary frequency, urgency, and discomfort, further aggravating symptoms. The high acidity often found in spicy dishes can also contribute to prostate irritation. Acidic foods and spices can lower the pH of urine, making it more irritating to the urinary tract and prostate. This can lead to burning sensations during urination, especially in individuals with pre-existing prostate or urinary conditions. Certain spicy foods are prepared with ingredients high in sodium or artificial additives, which can indirectly harm prostate health. High sodium intake can increase fluid retention and blood pressure, impairing circulation to the prostate. Poor circulation can slow the repair of damaged tissues, contributing to chronic prostate inflammation and discomfort. Spicy meals often stimulate the production of gastric acids. While this aids digestion, it can also lead to acid reflux or stomach irritation, indirectly affecting the prostate. Chronic digestive irritation may contribute to systemic inflammation, which can worsen prostate-related conditions over time. The discomfort caused by spicy foods can lead to poor hydration habits. Many people reduce water intake to avoid frequent urination, especially if they already experience urinary issues. However, dehydration can concentrate urine, making it more irritating to the prostate and urinary tract. Staying hydrated is crucial for maintaining a healthy urinary system and reducing prostate irritation. For men with chronic prostatitis, spicy foods can act as a trigger for flare-ups. The inflammation and irritation caused by spicy meals can lead to increased pelvic pain, discomfort, and urinary difficulties. Avoiding spicy foods can help reduce the frequency and intensity of these symptoms. Another factor to consider is the stress spicy foods place on the digestive system. Over time, the strain caused by frequent consumption of spicy meals may weaken the body's ability to manage inflammation and repair tissues. This can lead to a slower recovery process for the prostate and an increased likelihood of chronic issues.